You have to have visionaries. You know, you have to have people that will think outside of the norm.
We have to be given the power to tell our own stories.
We all want to say our piece. This is a crazy time.
What they care about is what it means to them.
You have to not think like society thinks.
This is a fight about power. Who has it and who has the right to use it?
We're having a reckoning about what public safety can, should, and must look like.
It's about a broader question of representation and who gets to create the images and define how we see the world.
They want their voice to be heard, they have to get involved.
Finally, we get to tell our truth and tell our stories like our stories matter.
What's going to bring people together is equality.
The love that we have for each other is the shortcut to true human happiness.
You start to see how it's all connected.
Every single person around the world can create a movement.
Hello, I'm Haley Romer, publisher and Chief Revenue Officer at The Atlantic. We are so glad to welcome many of you from across the country and around the world to Day 3 of our Atlantic Festival. We hope you'll tell us where you are watching from in the chat function. Our theme for the festival this year is Visions of What America Can Be. All of our speakers have ideas on how to build a better future, and we hope you will find them as inspiring as we do. And even though our programming is virtual this year, we want to remind you that there are still many ways for you to get involved from home. You can engage with other attendees via the networking function. You can talk with each other and ask questions for some of our speakers on the right-hand side of your screen in the Q&A tab. You can visit our Atlantic booth for additional offerings from across the Atlantic. And we have some special exclusives reserved just for Atlantic subscribers, so look out for those. And please consider subscribing if you haven't already. Before we get started, we want to thank our underwriters who support the Atlantic's journalism and have given us the opportunity to offer the festival for free. Our underwriters are Facebook, our founding level underwriter, Boston Consulting Group, EY, Genentech, Southern Company, and Walton Family Foundation, our presenting level underwriters. Allstate and US Bank as supporting level underwriters, American Federation of Teachers, Barclays, the Janssen Pharmaceutical Companies of Johnson & Johnson, the MacArthur Foundation, PayPal, Salesforce.org, and Truth Initiative as contributing level underwriters. Our exclusive media partners, NBC News. Thank you again. Now let's dive in. Enjoy the show.
Hello, everyone. I'm Eroded, the Chief Operating Officer for The Atlantic. We're so glad you've joined us for the festival this year. Of course, we're holding a virtual festival because of the COVID-19 pandemic, which prohibits us from gathering safely. And that social isolation has caused a steep decline in mental health for so many of us, especially young people who are experiencing mental health issues at alarming rates. Over the next hour, we'll talk with a series of experts about potential tools that can help provide a path back to a life of happiness, purpose, and reject harmful habits. Before we get started, we'd like to thank our underwriter, Truth Initiative, the nation's largest public health organization dedicated to achieving a culture where all young people reject smoking, vaping, and nicotine. And we want to remind all of you that you can be part of the conversation by asking questions of our speakers in the chat function on the right side of your screen. Now, let's dive in.
For a conversation on speaking out, please welcome Zach Williams, mental health advocate and son of Robin Williams. Atlantic senior editor Kate Julian is here to lead the conversation.
Hi, everyone. Hi, Zach. Thank you so much for bearing with us on the technical difficulties there.
Hi, Kate.
Hi, I know it's early out there in California, but I'm so glad to see you. I know, first off, everybody with us today, I think, will join me in offering our condolences on the loss of your father. I'm hoping that you could start by just walking us through your life over the past 7 years since his death by suicide, how that affected you personally and how it pushed you on the path to the work that you do?
Sure. Well, I would break up my life into specific stages. The first 2 years after my dad passed by suicide was very much about uh, grieving and managing the trauma that was impacting me in a pretty profound way. Um, at first, it was difficult to differentiate the process of grieving publicly versus grieving privately. And I had not experienced that before, and it was challenging to kind of find a healthy balance. I ended up self medicating a good deal using alcohol because I was diagnosed with post traumatic stress disorder, was experiencing a lot of dysregulation, was anxious, depressed, and kind of lost my footing. So, that was the first stage. The second stage was very much about finding ways to support myself and my mental health, specifically mental health advocacy. I found to be very helpful in healing. That means working with organizations like nonprofits and supporting them on their various initiatives, joining boards, starting to work with the organizations on a deeper level, helping establish new campaigns. And, for me, that helped me heal from the trauma through service. And then the next stage, and this has been the past few years for me, has been really around how I can build around that idea that service is a path to happiness and determining what's really working for me and really finding opportunities to do more of that has been outstanding. Also too, I'm father of two young children. That's been part of this next stage for me, and becoming a dad has been really healing for me, and learning more about myself through showing up for my kids, and also understanding what it is to deal with mental health issues and recovery and the like, as not only a parent but understanding it through the lens of my kids and the like. So it's been a journey, but at this stage for me, it's really about growing as a person, learning more in terms of how I can be the version of myself that not only I want to be, but one that's healing continuously and showing up for others in a meaningful way.
I have to say, I find the transition you've made really inspiring, and we'll talk more in a few minutes about some of the specific initiatives that you're involved with. But first, I'd like to pause and talk about the self-medication issue that you raised. You've been really candid about how challenging that period was for you, and we know that during the pandemic, a lot of Americans have used substances, drugs, alcohol in the same way to deal with their own depression and anxiety during this period of time. And I'm wondering if, stepping back from your experience, if you have any observations about what we can do to keep so many people from feeling like they are stuck taking that measure.
Absolutely. It's a great question. For me, just for a little bit of context, I mean, I had always used alcohol to manage my anxiety from a pretty early age. But that self-medicating turned into pretty consistent abuse subsequent to my dad's passing. And then beyond that, I found myself drinking alcoholically consistently. And ultimately, it led to a lot of really damaging health issues, both in terms of my body, but also in terms of my mental health. And so, I'm proud to be sober and have been for over 4 years at this point. But, from a lens of self medicating, especially as you're talking about managing mental health issues, anxiety, depression, and the like during the pandemic, it's been hard because people are more isolated than ever. often not having opportunities to connect with people in person, or if they do connect, in a very limited way, especially if their health is compromised or if they're at risk in some way. And then coinciding with that is this, this sea change in how people are using technology to gain access to goods and services, right? So, alcohol, drugs, and the like are about as easy to get as they've ever been. And as
You
a
can
result of,
order cocktails for delivery. You can order a case of beer for delivery. You can order a lot of things for delivery.
right. And so, when you're at home isolated over long periods of time or dealing with a lot of stress with family situation, kids, what have you, and trying to manage childcare and education and your own work at the same time, it can be overwhelming. And so, what I found, at least in terms of the data with the organizations I work with and the academic institutions, is that the increase in usage of drugs and alcohol has very much been a function of trying to manage mental health, right? And so, from my lens, what I advocate for is finding your mental health hygiene ritual. First off, if you're finding yourself uh, abusing things like alcohol, there is help. You can find services, communities, organizations that can help you.
Yeah.
But if you're saying, "Hey, I'm using substances as a means of self-medicating because I'm stressed out or because I want to escape or be euphoric," or like, there's ways to achieve that in very healthy means. And so, for me, I always
Yeah.
establish my mental health hygiene ritual in the early part of the day so I can have great days.
Could you actually pause and talk about that? I know it's been such a challenging year and a half for many of us. So before we get on to some of the other questions I have for you, what are your tips? What are the things that have gotten you through those things the past 18 months?
Yeah, sure. So, for me, taking a lens of gratitude and actually establishing a short list every day of what I'm appreciative of has been absolutely outstanding start to the day. Um, and then coinciding with that, kicking off a mindfulness routine, short meditation. Um, that's a good primer. And then from there, I try to limit caffeine intake. If I drink too much caffeine, it kind of gets me wired. Um, I I try not to eat too much sugar. That's kind of more of a dietary thing. I make sure that I'm eating the right things, so nutritionally, that's important for me. Try to eat more balanced. I've recently gone vegetarian, and that's been a game changer for me in terms of clarity and energy and actually just general mental health. Um, but then also, I found that establishing a fitness routine, however light or heavy, um, providing it hits a certain bar, and I would say about 30 minutes of exercise is a good starting point. That helps actually establish endorphins and kind of get a little bit of, beyond getting the blood moving, actually establishing a base of feeling good. And then coinciding with that, I do engage in uh, you know not only connecting with friends and family on a consistent basis, ideally in person when I can, but also community oriented activity. For me, as someone who's been in recovery for a period of years, I need this. I need to connect with other people in recovery. But adjacent to that too is therapy. That's been extremely helpful for me. Um, and then there's a
You
number of
know,
other things we could go on, but having that personal mental health hygiene ritual is essential, and it's part of my orientation around, finding that solution or that collection of treatments, that mosaic that's right for you.
it's a great seg to the next thing I wanted to ask you about. So all of those things you've listed are such great, important personal measures. But when we're looking at this picture from a societal level, there are some other things that we need to deal with. People sometimes complain that our approach to treating mental health is stalled. Most of the treatments that are available have been available for quite a while. They don't work for everybody. I'm interested to hear a bit more about your company, Kim, which is taking a slightly different approach to thinking about sort of the suite or sort of wraparound set of tools that people might need. Could you tell us just a little bit about sort of how this approach is different?
Sure. Well, I started my company, PIM, because when I stopped drinking alcohol, I was having more anxiety and stress than I'd ever had, and was really frustrated and started seeking alternative options to manage that stress. And I learned about neurotransmitter health through my wife, Olivia June. She introduced me to the idea that if you manage your serotonin system, catecholamine system, which is norepinephrine, epinephrine, dopamine, your GABA system, your endorphins, and kind of adjacent systems, you can actually manage a lot of that mental health dysregulation that you're getting throughout the course of the day. And through learning about neurotransmitter health, I was kind of blown away. I didn't realize that you could actually take these natural compounds to basically solve for your personal deficiencies. And so I started doing research around creating a formulation that would help manage people's stress and anxiety, and realized there's an opportunity to build a brand that stands for breaking down stigma, and like the Atlantic stands for journalism. and and so uh, so we created a company. My wife Olivia and I created a company to have a stigma breaking brand, but to also create products and get them to people that are safe, effective, and natural, and um, and have those products manage neurotransmitter health. So we launched our first product just over a year ago, called the PIM Mood Chew, and it's meant to provide safe, natural neurotransmitter support. But where we're going with this is actually establishing a whole mood management system, so you could manage your entire neurotransmitter environment through taking a collection of products. And really, what that comes down to is, for any given individual, they're experiencing a set of a set of deficiencies, and it's actually the majority of Americans have neurotransmitter deficiencies, and um, and if you manage for those deficiencies, and then you can focus on the other things that can matter relating to your mental health, like therapy and community support, mindfulness, meditation, fitness, all those things. But if you're not getting the appropriate neurotransmitter health, then you're at a deficiency from the onset.
It's fascinating. We have a comment coming into the from the audience that says we need to teach youth about how to understand how their minds work. And I'd like to leave this sort of as my final question to you. As you look forward to raising kids, got two very, very small people, what do you hope to teach them about what they need to do to be mentally healthy?
Well,
what do you
thing,
hope that their experience of growing up in the 2020s will be like?
Well, there's a couple of things. The first thing I would say is I would want to teach them or help instill values within them to be kind. That's the most important thing I could think of, because great things will come from just being kind. Kind to yourself, kind to others, kind to the world. And then, stemming from that also is finding the path that works best for you. That goes beyond mental health. That goes to around career path, pursuits, things that make you happy, just being able to have an opportunity to be open to learning and to be able to identify when you're experiencing dysregulation, experiencing bias, and understanding how those biases are impacting your decision making and your well-being. I think self-awareness and kindness are really what I would hope to instill within my kids.
That seems like a really wonderful note for us to end on. Thank you so much for being with us today, Zach. It's been such a pleasure.
Thank you. It's been, absolute privilege to be here. Thank you.
Thanks.
Next up, a session brought to you by our underwriter Truth Initiative, exposing vaping as a mental health issue. Please welcome Daniel Jeffrey Ament, president of Fight for Wellness and a former vapor, Dr. Vivek Murthy, the U.S. Surgeon General, and Robin Koval, CEO and president of Truth Initiative.
Hello, everyone. First, I want to give a huge thanks to The Atlantic for hosting this important conversation today. Truth Initiative cares deeply about the physical and mental well-being of our nation's youth and young adults. Through our highly acclaimed National Truth Public Education campaign, we helped drive down youth smoking rates to historic lows and prevented millions of young people from becoming smokers. We're applying these same proven effective, research-based programs to help end our nation's pervasive youth e-cigarette epidemic, including a text message quit vaping program designed specifically for youth called This Is Quitting. A hallmark of our success is to give young people the facts and information they need to make informed choices to live their best, longest, and healthiest lives. As we've discussed throughout this summit, COVID-19 has exacerbated mental health issues for young people. A recently published study in JAMA shows that youth depression and anxiety doubled during the pandemic. Yet the very thing that many young people are turning to for relief is actually making it worse. The science is well established that vaping nicotine worsens anxiety symptoms and amplifies feelings of depression. But we want to make sure young people know this too. That's why we're exposing this fact through our latest Truth campaign called It's Messing With Our Heads. And in the voice of the Truth campaign, which is always a little edgy and willing to reveal tobacco industry tactics, this work is based on a new, fictional vape product that points to what vape companies haven't been telling you about the connection between nicotine and mental health. Let's take a look at 3 quick videos.
Why be happy when you can be sad? Vaping nicotine can amplify feelings of depression and anxiety. Depression Stick. Learn more at depressionstick.com.
I helped create a vape that makes depression convenient.
What is this? My new product, the Depression Stick. Nicotine can amplify depression and anxiety, so I'm trying to sell some depression. Anyways, sadness, stress,
All those vape pens that you're carrying, I mean, they pretty much do the same thing as mine. I'm just being honest with my marketing.
What are you talking about?
You don't want to sell depression?
No, you gotta get out of here.
Your loss. Bring in the influencers. Today, I'm auditioning influencers to promote Depression Stick online.
What is it?
It's a vape pen. Like all those vaping companies, the nicotine can amplify feelings of depression and anxiety.
So it purposely makes people sad?
Talk to your followers.
So look, yo, I can't do that, yo.
This is a sick thing.
Other influencers have.
I don't care.
Joining me now to talk more about how nicotine is unsafe for young people is U.S. Surgeon General Dr. Vivek Murthy. Dr. Murthy issued the first ever Surgeon General's report on youth e-cigarette use in December 2016. First, Dr. Murthy, thank you so much for taking the time to be here today, as we certainly know how busy you are. In your youth e-cigarette report, you talked about how unsafe nicotine is for young people. Can you tell us more about the science behind that and how it also has serious implications for mental health?
Well, thanks, Robin. And first of all, it is so good to be here with you today. And I just want to say a big thank you to you and to the Truth Initiative, just for everything you've been doing over the years to help us tackle tobacco use in our country. It's been just incredibly valuable and has clearly saved lives. And the recent ads that you're putting out, I know, are one more step in the direction of trying to help us overcome the latest version of our challenge with regard to tobacco, and that is the e-cigarette challenge we face, particularly among our youth. Now, in 2016, as you mentioned, we put out the first federal report on e-cigarettes on youth. It was our Surgeon General's report on e-cigarettes. And what we laid out there is what the science told us, which is that nicotine is highly addictive. It harms the developing brain, which is one of the reasons why we're particularly concerned about it with adolescents. We're also concerned that nicotine use can increase the likelihood of being addicted to other substances as well. And with e-cigarettes, these have sadly been yet another pathway through which young people have been exposed to nicotine-containing products. In recent years, it's been disturbing to me also that the formulation of this nicotine has been changing in ways that allow higher levels to enter our system. And there is a growing body of science that is showing us that nicotine may also impact our mental health. The effects on our physical health have been well documented. But consider some of these studies recently. In 2019, there was a large study of about 30,000 e-cigarette users that was published in the Journal of the American Medical Association, also known as JAMA. And what it showed is that current e-cigarette users have double the odds of having a diagnosis of depression compared to those who have never vaped. That's concerning. There's also another study which showed that vaping is significantly associated with higher levels of ADHD symptoms. This is again a 2019 study of college students. So like this, there are other studies which have demonstrated that there seems to be an association between e-cigarette use and symptoms of depression and other mental health concerns. And so while we have more to learn about the impact of nicotine on mental health, these studies are concerning and they add to the reasons that we need to reduce the use of e-cigarette by youth. If you put this in the context of what Robin mentioned earlier, which was the pandemic, I think we all know that the pandemic has taken a real toll on our mental and physical health. And we've got to do everything we can to make sure we're bolstering our health at this time of crisis. And when it comes to tobacco, look, we've come a long way overall in getting out the word on youth e-cigarettes, but we've got to do a lot more to protect millions of young people who are still exposed to nicotine through e-cigarettes each and every day. Ultimately, I do feel optimistic that this is a challenge that we can tackle as long as we do it together, because the progress that we've made over the years with traditional cigarettes does give me hope that if we apply ourselves, if we use science to guide us, if we work together in communities, if we push back against the industry factors which may be driving the marketing of these harmful substances to our children, then we can make progress, we can save lives, and ultimately we can prevent the scourge of tobacco-related disease from affecting more people.
Thank you, Dr. Murthy. That was really helpful. And always, thank you for your wisdom and your leadership on the youth vaping crisis. I want to wrap our conversation by introducing our audience to an amazing young man, Daniel Ament, to share his story about how vaping nicotine wreaked havoc on his physical and mental health. In fact, Daniel is one of the world's first ever double lung transplant recipients. Welcome, Daniel. It's great to see you looking so well. Please tell us a little bit about your story.
Thank you. When I was 16, I received a double lung transplant due to vaping, and I vaped mostly the brand Juul. I also vaped the least amount out of anyone else I knew that was vaping. The first day of my junior year, I hadn't vaped in 4 days because I was quitting, and I woke up to go to school and I felt very sick. I went anyway, so I wouldn't miss my first day, and by the next day, I couldn't breathe and I was in the ER. The doctors took x-rays and told me I had anxiety and that nothing was wrong. Before this, I played 4 sports, I had a 4.1 GPA, and I was in really, really good shape. The last thing I remember was that the doctor said I had anxiety. The next thing I knew, I was waking up in the hospital from a coma, and I had zero memory of the 55 days prior. I woke up unable to perceive who, what, or where I was. I was having delusions and hallucinations. I thought the nurses were trying to kill me, among other things, and I was 99 pounds from 155 pounds. I was unable to move any part of my body on my own, and I had a trach in my neck that disabled me from talking and eating for the next weeks of recovery. My muscles were atrophied, so it took weeks to sit up and even longer to stand. My first time standing was probably less than a second, go on the next day, maybe a second, and that continued until I could take 3 steps up the stairs on my own. Then I was discharged from the 4th hospital of this entire experience. This experience was very traumatic and has caused PTSD, depression, and severe anxiety that continues to this day. I continued recovering out of the hospital, and I started Fight for Wellness to spread my story so that no one would be unaware of the dangers of vaping. The mental toll from my transplant was large, and my continued mental health struggles led to me overdosing. I was able to fully recover, but now COVID was happening. I had to spend all of my time in my room away from my family and anyone else because of my immune system. This made everything worse. I started cooking for myself, and I worked out every day so I would be healthy enough to accomplish my new goals of creating and producing music and videos, which I had always had an interest in. I believe that the first step to getting teenagers away from vaping starts with radical change in lifestyle that will allow them to make the decision to quit and have the mental power to actually follow through with it. Just like I used better foods and working out to have mental power to go after my new goals. Most teenagers I have met that are still addicted to vaping know they have a problem and want to quit, but do not have the mental power or enough of a reason to do so. I believe that focusing on a more goal-oriented lifestyle will empower them to be able to quit and live better lives.
I just wanted to say thank you, Daniel, for sharing your story. I know we haven't met before, but I had read a little bit about your story beforehand. I was just, first of all, just so sorry to hear about everything you've been through. But just also so appreciative of your courage in coming forward and sharing some of your story and helping to warn other people, especially young people. So just wanted to say thank you, Daniel, for what you're doing.
Thank you, Daniel, for sharing your very powerful story. I know it will help so many young people avoid the health consequences of vaping nicotine. We wish you continued good health. And of course, Dr. Murthy, thank you for all you're doing to continue to combat the youth e-cigarette epidemic and, of course, to help our nation through these unprecedented times. And with that, back over to you at the Atlantic.
Our next discussion is on finding hope. Please welcome Miana Bryant, founder of The Mental Elephant, Amit Paley, CEO of The Trevor Project, Holly Wilcox, professor in the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health, Atlantic staff writer Amanda Mull is here to lead the conversation.
Good morning, everyone. Just a quick note before we start, Miana was unable to make it this morning, so we're here with Amit and Holly. Thank you both for joining us. We really appreciate you coming to have this conversation with us this morning.
Thank you so much for having us.
This first question I have is for you both. I'd love to hear what you think. Young people have experienced a rise in mental illness for years now. This problem predates the pandemic. What were some of the major drivers that you both saw in these rates of mental illness before the pandemic, and how did the pandemic exacerbate them?
I can jump in and go first. In the United States, rates of in Generation Z, rates of anxiety and depression have been increasing, whereas some other problem areas among young people have been decreasing. And unfortunately, the suicide rate among young people has been increasing. It's the second leading cause of death. And some aspects of the pandemic, such as the abrupt changes in their schooling and social networks really played a role, I think, in social isolation and perceived lack of opportunities or changed opportunities, and really has made an impact on some of the major risk factors as well for suicide that has made all of us in this field of suicide prevention very worried.
And I can just jump onto that there are so many factors going on in society, COVID-19 being one thing that is going on, but many factors in society that have created more challenges for young people, and that those challenges are particularly acute for young people who face who have marginalized identities, who face particular discrimination and stressors in society. So at the Trevor Project, we exist to serve and prevent suicide among LGBTQ young people. And COVID-19 was a very, very challenging time for all young people because of some of the types of social isolation, physical isolation that Holly was talking about. For LGBTQ young people, it was particularly acute. Our research at the Trevor Project found that 70% of all LGBTQ youth said their mental health was poor most or all of the time during COVID-19. And that is in part because LGBTQ young people, many of their sources of support were for K-12 students. They were when they went into schools, and they might have had that one supportive teacher or a guidance counselor who understood them, or a GSA. And then they were cut off from those physical sources of support, and they might have been trapped with families who are unsupportive or in some cases emotionally or physically abusive. For university students or college students, many of them come out for the first time when they get to college, but they don't come out to their families. And then when the pandemic forced them to quickly go back home, they had to make a really difficult decision. Do I come out to my family when I wasn't prepared or expecting to do that, or do I go back into the closet? And so you can imagine the strain that puts on a young person's mental health on top of all the other challenges going on in their lives.
Absolutely. Holly, my next question is for you. Your research focuses on the prevention of suicide over the course of adolescence and into young adulthood. How have you seen the pandemic impact the mental health of the young people you work with?
Yeah, that's a really critically important question. The biggest thing for us in the field is that the programs and the projects that we implement in schools, we haven't been able to carry them out because of the when schools were closed and there was online learning. And so the supports that students had in place through their school, like different programming, access to mental health, staff and counseling staff, and different supports as part of school were not available. And a lot of the programs that I work with that I like to deliver in school-based settings some of them were not appropriate for a quick transition to online, and were not really safe enough to transition quickly to a virtual format. So the pandemic has changed the landscape of the field in some ways of school-based suicide prevention, because the opportunities that we usually had to identify students early and get them help were put on hold until students are back. And now the transition back and students getting back to being in person and adjusting to that and it has been a bit of a challenge, but also recognizing that students may be coming back with more need than they had in the past, and how can we best address that need?
To follow up on that, Holly, according to a recent CDC study, from February to March 2021, suspected suicide attempts were over 50% higher among teen girls than during the same period in 2019. Why do you think the pandemic may have been particularly antagonistic toward the mental health of young women and young girls?
Yeah, we see kind of a closing of the gender gap. We've been seeing when we look at our surveillance data in the United States, not only for suicide attempts, but also for suicide among young people. We see that there used to be a 3 to 4 fold more males dying by suicide, and we see that gender gap is narrowing. And so it's a problem that we have to adjust to, and it could be from the issue that I mentioned earlier, that rates of anxiety and depression we're seeing more, usually with young people. Oftentimes, in terms of the suicide risk factors, depression is one of the leading risk factors, especially untreated or unmanaged depression, but also anxiety, substance abuse, and impulsive traits, aggressive traits. And oftentimes we see that underlying risk can be exacerbated or increased by different triggers that happen, like stressors that happen in their life. And so oftentimes that kind of cascade of events, the underlying risk with some stressors that are happening, like a relationship breakup or problems at home or at school, cyberbullying, exclusion, and all kinds of like that cascade of events can increase risk. But that's cascade is really common. This is one of the problems in the field, that cascade of events, the underlying risk with these stressors is not uncommon at all in young people. And so we really need to be more focused on firearms. And if someone has access to firearms in their home that aren't secured, and they have that cascade of events, their risk is much higher. And we also have to think about how to enhance the supports to protect them. Like, can we teach them skills in coping, in problem solving, so that when they do have this cascade of events or chain of events that I just mentioned, they can navigate it and they can get through it on their own, or at least they know when to get treatment and when something's a crisis. So those are just my thoughts on the issue.
Yes. Amit, to expand on that, I know that also LGBTQ youth experience higher rates of mental illness and suicidality. Can you tell me about some of the systemic factors that impact the mental health in that group?
I can, and I mean, so the data is heartbreaking and very upsetting. LGBTQ young people are more than 4 times more likely to attempt suicide than their peers. And I think it's really important to make sure that people know that is not because there is something inherent about being an LGBTQ person that makes you more likely to attempt suicide or to have mental health conditions. It is because of the discrimination and rejection and isolation that LGBTQ young people face from society that results in those actions. It's part of a whole body of research known as the minority stress model. And so one of the ways that we can work to improve mental health outcomes for LGBTQ youth and to reduce suicide among LGBTQ youth is making sure that they are more accepted and supported in society. And we have, unfortunately, as we've seen in some cases, progress for LGBTQ acceptance. We've also seen unfortunate trends of the opposite happening. We've seen over the past year in particular attacks in state legislatures across the country, specifically targeting children, trans and non-binary children, trying to prevent them from being able to play sports, trying to prevent them from being able to use the restroom in schools, trying to prevent them from even accessing appropriate medical care. And the Trevor Project's national survey on LGBTQ youth mental health, which I mentioned before, found that 94% of LGBTQ young people said that recent political events, the recent political climate, negatively impacted their mental health. I mean, from a public health perspective, 94%, that's almost everyone, said that the political environment is harming their mental health. And so I think that sends a message to what we need to be doing as individuals, as a society, and for our lawmakers, that the words that they say really do matter. Young people are listening, and that we need to be focusing on sending messages of support and hope to young people, and not messages that are attempting to exclude or put down or alienate and isolate young people for being who they are.
Absolutely. Amit, how does our healthcare system impact that? Does it harm? Does it help? What kind of response do LGBTQ youth often encounter in these kinds of settings?
Well, there are LGBTQ young people who benefit tremendously from the healthcare system, and there are providers and parts of the healthcare system that are doing life-saving work that are helping LGBTQ young people every day. And we know that the healthcare system overall is not doing nearly enough and is failing in many regards to meet the needs of young people. The research I mentioned before, the Trevor Project conducted, found that nearly half of LGBTQ young people wanted to access mental health care, but could not access it. And that's in part because of affordability issues. That's in part because of access issues, depending where young people are. And then in some cases, the healthcare settings and providers are not LGBTQ competent. And so for a young person who is really struggling and facing rejection and isolation, if they end up going to a therapist or a provider and that person doesn't understand their identity and acts towards them with some degree of homophobia or transphobia or biphobia and not understanding them, it can really set them back. That if the helper is not helping you and is hurting you, it can both not help you, it can send negative messages, and it can make it less likely that you will seek help in the future. And so we have a lot of work to do as a country, as a society, to make sure we have robust services that are available to everyone, that they are culturally competent and appropriate and supportive. And I do think it's important here to mention, I'm talking about LGBTQ young people, but this spans all identities. We see, in particular, when we talk about race, that there's a lack of access for people of color, for youth of color, and that much of the services that are provided are not necessarily competent or understanding the unique needs of youth of color. And then when you compound that with the multiple identities that young people hold, if you're a Black LGBTQ young person, if you're a Latinx LGBTQ young person, it can be even more challenging to find that help and support that they need and that they deserve.
Absolutely. Holly, for you, what are some of the early signs that a condition like depression can lead to a suicide attempt? What should parents and community members be looking out for?
Sure. Well, depression isn't always easy for parents to recognize. Sometimes it manifests itself in younger children and in some children as irritability. And so depression is hard to recognize for sure. One thing that families should be looking for is a dramatic change or a shift in behaviors, in mood. So look for frequent or pervasive sadness or agitation, like I said, real extreme irritability, changes in habits, sleeping habits, eating habits, social isolation from friends, not doing the things that they typically like to do, but also look for complaints, especially from young children, like about physical symptoms, stomach aches, headaches, fatigue. Sometimes those somatic symptoms could actually be related to their mental health. Also look for declines in schoolwork, preoccupation with death and dying. You got to take these threats, or when people talk about suicide, they should be taken seriously. I know it's stressful for, to have a conversation with somebody about their risk, but the research shows that it's really best to be proactive and to go ahead and ask them if they're thinking about suicide. Some people will be very relieved when you just ask them and they have the chance to talk about it, because the stigma, there's just so much stigma in this domain. And so having an open conversation and discussion could save their life.
Right. This question is for both of you. How can youth help each other? How if you're a teenager and you sense that a friend is struggling or a classmate is struggling, how can kids be the link to mental health for their peers? Amit, can you start us on that?
I can, and I think I wanted to underscore some of what Holly said because it's so important. It's important for everyone, including young people, and talking to your peers, to be looking for signs that someone might be in distress and needing support. And if you are noticing that, it is important to ask someone to have that conversation. And as Holly said, that can be scary for some people. There are some myths that asking about suicide may make someone more likely to consider or attempt suicide. And that is false. The research shows that is not correct. In fact, as Holly said, asking someone directly, are you thinking of killing yourself, not only will not harm them, it can open up a conversation that can be life-saving. And so really getting people comfortable breaking these stigmas, breaking these taboos, and any young person that is watching, I want to encourage them, if you see your friend struggling, to ask them, check in with them how they are doing, and to be able to ask them directly, are you thinking of killing yourself? That opens up a dialogue or a conversation that in and of itself can create support for that person so that they can feel heard and affirmed for who they are. And then you can provide them with resources. And if someone is really in a crisis situation, you can help them get access to care, or if it's an emergency situation, to places that can provide that urgent and emergency support. The other thing that I do want to mention is not just at the moment of crisis to be looking out for ways to support people, but what are ways to provide support in general. And when we create conditions where people feel accepted and supported, that improves their mental health. In the case of LGBTQ young people, our research shows that having just one accepting adult in an LGBTQ young person's life, just one, reduces their risk of suicide by 40%, 40. It's a huge, huge amount. And so I hope everyone listening to this knows, yes, there are systemic things we need to do in our culture and in society. Those are big things we should advocate and try to have that change. But also every single person has the power to help reduce suicide by being an affirming and accepting person. And so I hope people can take that away, that is what they can do every single day in their lives to make a difference and help save lives.
How?
Yeah, I mean, one thing we see a lot is a young person may be suicidal. The first person they go to is a friend, oftentimes, if they're suicidal. And sometimes the friend is either sworn to secrecy, or they're very fearful that if they go to a trusted adult, they could actually make the situation a lot worse. And so I think just empowering young people to trust their gut and go to an adult, and don't keep these secrets, because their friends' life is in jeopardy potentially, or their well-being. And so it is best to go to an adult, because these types of complex crisis situations, it's best to not try to manage it as a teen on your own, but to enlist the help of a trusted adult who can step in and who can really work with the young person at risk to try to get them the help they need.
Right. That's so important. Well, I think that we've run out our time here. Thank you both so much for joining us today to talk about such an important topic, and thank you everybody in the audience who joined us today. We've got lots more Atlantic Festival events coming up over the next few days, and you can find the schedule for all of them on our website. Thank you.
Thank you.
Thank you.
While we're on a break, we encourage you to network with other attendees and visit our expo booths. To participate, select the networking icon located on the left-hand side of the screen. Next, click Join, and you'll be randomly paired with another attendee for about 5 minutes. If you wish, you can exchange virtual information with each other and keep in contact via direct message within the platform. You can also click the Explore icon to visit our virtual expo booths. Here you can explore more resources from the Atlantic and our underwriters related to today's event. We'll see you shortly after the break.